morning. Hello, my name is Lisa Killian. I'm the Assistant Administrator of Marketing and Public Relations for South Texas Health System. We'd like to welcome you to McAllen Medical Center's press conference this morning. I'd like to go ahead and start our press conference by introducing our first speaker this morning. We have our Chief Executive Officer, Todd Mann, from McAllen Medical Center.
Great, thank you guys. Thank you for being here. It's a wonderful day, wonderful announcement to make. First of all, I'd like to thank some distinguished guests. Obviously, the folks sitting up here, Mayor Darling, Veronica Whitaker, our commissioner. Thank you guys for supporting the South Side. We appreciate all you do for our city and our hospital. Humberto Rodriguez is our South Texas Health System board chairman. Rudy Alvarez, Dr. Alvarez is one of our distinguished medical members, and of course Lisa as well as our marketing. So thank you guys. Also want to thank Doug Matney. He's our UHS Vice President, Regional Vice President. I would like to thank our partners, Spa Glass in this project, McConnell Roberts, Smith Painting. But more importantly, I would like to thank the staff that make this hospital a great hospital, and you've done that for 98 years. Thank you for what you do for our community and this hospital every single day. So with that, kind of like to talk a little bit about the history of the hospital. It's pretty amazing that McAllen Medical Center has been serving this community for 98 years. Pretty impressive when you think about it being the first hospital here in McAllen. It was originally built in 1919 downtown in its original location, where it served this community for 50 years, including giving birth to my mom. So it's pretty amazing that I could sit up here as a CEO today and support the hospital where she was born. But we were always the first here. We did a lot of first and innovative procedures here, really setting the lead for healthcare in the Rio Grande Valley. After the 50 years serving downtown, it moved to this current location. Anybody that was here in 1985 remembers this project vividly as the big white structure rose up from the ground. It's the White Hospital as we know it today, with its innovative design, with its contemporary colors inside. It really became a pillar of McAllen, not only for its architectural standing, but also for the health care that it delivered to the Rio Grande Valley at large. So impressive history. Today, we're very, very excited to embark upon a project that'll rebrand this facility into a contemporary, more modern facility with a hotel-like atmosphere, focusing on our patients, our families, our physicians, and our staff that choose to be here. It's a very, very exciting day. Our parent company, UHS, is investing $22.7 million into an aesthetic upgrade for this facility. It'll first comprise of an exterior component of that, which will be a brand new parking lot, brand new landscaping, and as I mentioned, it will not be El Hospital Blanco anymore. It will be something else, and you'll see the colors. So a big day for McAllen and this hospital. The interior, as I said, is really going to focus around the comforts of the hospital. We really want to bring that hotel-style atmosphere, and it's going to start in the patient rooms. It's going to start with patient experience, new bathrooms, new corridors, new nursing stations, new elevators, a new lobby, a new dining, a total renovation of this facility. So if you want to go inside and take a peek of history, do so, because it'll look much different in about 15 months. Yes, I said 15 months. This is going to be a very, very quick project with a lot of work going on. Apologize for, in advance for any inconvenience. Obviously, we're a hospital that runs 24/7. We'll continue to do so. So we'll definitely have to work around a lot of the construction efforts going on. But a very, very exciting time. I'm very excited about the project, very excited about our future, and more importantly, I'm proud to be a leader of healthcare delivery in the Rio Grande Valley. So with that, I'll turn it over to Mayor Darling for a few other comments. Thank you.
Thank you, and good morning. It's a very exciting day. You know, I go back. I started with the city in 1979, and so I remember the transfer of the hospital when the city decided to get out of the hospital business, we actually had some litigation going on about the ability to do that as a city, and so the license is what we transferred, not the buildings, which got us around some of that litigation. So it is true, I think the license maybe it still has McAllen General on your license, but that was a license that came here. But I think one important thing is we first started off with Methodist Hospital of Dallas, and they were going to build a new hospital, and after all the plans were done and it kept getting bigger and bigger, they couldn't afford to do that. And that's when UHS stepped in. And so we wouldn't have this hospital today without UHS stepping in and making sure that that transition in 1985 was a smooth one and a very successful one. So this is an iconic building for the expressway. By the way, on the expressway, we have nothing, this is a state project out here. And they didn't listen to us, but they're going to do a couple of things. They're going to raise the bridge on 2nd Street, and of course they're going to raise the bridge on 10th Street, and they're going to take down the Bicentennial, overpass and make that underpass and the expressway go over it. So you're going to actually beat the state at that because it's a 2-year project for the state, so they maybe should hire you. But this is an iconic building on the expressway. And it's very exciting to see that, you know when you're McAllen when you see this building and you see the hospital. And so we're very, very excited about the upgrades. We like the white building. It really stood out, and great advertising. I asked if they do political advertising on the wall. I might have a deal with them. But it's a very, it's a lot of our kids have been born here, and a lot of our parents were here. And so it's very, has a very sentimental value for me too. So I'm very happy to be here, and $24 million is great, and we appreciate all the hospital does for our community, not only in what the health care they do, but the participation in all the civic endeavors. So congratulations. Thank you.
I'd also like to welcome Veronica Whitaker, our City Commissioner.
Good morning, everyone. First of all, I'd like to congratulate UHS for believing in McAllen and for bringing what they believe is a top-notch hospital to our city. So I congratulate you, and we're very, very happy to be a part of this morning because it is exciting. I literally grew up with McAllen Medical Center. My father had a pharmacy directly across the street. So as soon as I was able to cross the street by myself, I was told to go across the street and take the medicines back and forth. So I would go back and forth to McAllen Medical to make sure that when the hospital ran out of medication, my father was able to fulfill those medications. I'd take them across the street, and then they'd come back and forth. So I was very familiar with McAllen Medical. And back in the day, my mother was a candy striper. I don't know what they're called today, but my mother volunteered for many a days at McAllen Medical. So what are they called today? Well, they came from candy stripers to the red ladies, so that is great. So yes, I have been definitely a part of McAllen Medical for many, many years, and I applaud you today, and I applaud those who believe in McAllen and to give back to our community. And a facelift is always welcomed because it brings new vibrations to what you're doing. And so thank you again, and thank you, staff. Thanks.
Next on our agenda, we have Dr. Rudy Alvarez speaking on behalf of our medical staff.
Good morning. I'm very proud to be here representing the medical staff. My name is Rudy Alvarez. I was born and raised in McAllen and came back to practice here. I've been practicing here with South Texas Health System on the medical staff for almost 5 years. I'm very proud of our medical staff and our hospital. We have such a collaborative relationship. In a few moments, you're going to see designs of the hospital, and you're going to see the shell that's going to go up. But what you're not going to see is some of the top care, some of the top specialists that we have. And that's what patients can experience when they come into our hospital. They're going to see the protocols that are immediately activated when we recognize things. They're going to see the latest evidence-based medicine that has been done cooperatively with administration, because this administration, this leadership in our hospital is one of the best ones that I've ever seen. They're eager to get physicians' feedback. They want to work with the community. And as we see them double down on their commitment and their infrastructure and their commitment to the Valley. I just want to highlight that we have some of the top specialists. We're recruiting more physicians as we come along. Within the next couple of years, you're going to be seeing specialized care, more specialized care, services that are not offered in the rest of the Valley. And we're happy to be part of that and to grow with the hospital. And we're going to see more of that as the years go by. You're going to see that clinical alignment between physicians and between the hospital. And we believe that's the best kind of patient care that can be given. We know that because there's more communication that occurs, and there's more development. Already we're seeing the hospital collaborate with physicians yearly on their budget, whether it's through the technologies that we bring in, whether it's the equipment, we're bringing in the latest things. Physicians are coming in, they're bringing in all their training, we're recruiting even more physicians. We believe we provide the best care here, and we're going to collaborate with the surrounding hospitals so that we can offer those services, help where we can, and also so that we can help our community, which we feel is a very special group of individuals. We feel that they're family. Nobody's turned away from our hospital. We take in every single person, and we're happy to do that. I want to also highlight that some of our medical staff are doing very specialized care. We have some of our surgeons that are offering the intragastric balloon procedures. Our pulmonologists are doing the endobronchial ultrasound procedures. Our oncologists in our laboratory is doing molecular targeted cancer therapies, which is personalized medicine, where patients have better outcomes because cancers can be treated specifically toward their mutations. And we have an acting level 2 trauma center. We offer the highest level of trauma care in the Valley. We have in-house 24/7 trauma surgeons, and we hope to provide that care and continue to provide that care. So we'll continue to bring the best patient-centered, evidence-based medicine to our community. We're going to further collaborate with our surrounding hospitals. Our medical staff is one of the strongest ones with a very strong relationship with our hospital leadership. And we're going to also see, you're not going to see some of the things that patients are going to experience, but we want patients to know that when they come in, we believe that having families surrounding the patients is better care. We know that that provides comfort to patients. So we're doing the small things. We're providing the fold-out couches where families can sleep with their loved ones. We're remodeling the rooms because those are some of the tangible things that patients can see. They sometimes don't know about the technologies, but we want them to have an overall experience. And our physicians here look forward to working with the hospital, providing the support and feedback they need. Thank you.
Our final speaker this morning at our press conference is Humberto Rodriguez. He is our chairman of the board for South Texas Health System.
Thank you, Lisa. I don't know about that word final, But when Todd was mentioning that the hospital had been here 98 years, I saw Joe Rodriguez in the back, the CEO for South Texas Health System, say, he hasn't been here 98 years. No, I haven't, Joe. I've been here 30 plus years. I'm not going to tell you. But no, seriously, on behalf of the Board of Governors, thank you very much for being here with us this morning. Lisa told me that I needed to cut it short, and I only had like 30 minutes. So, but Lisa and Carrie, thank you very much for everything that you do for UHS and South Texas Healthcare. I also wanted to thank our big boss, Alan Miller, and of course his son Mark, who's the president of Universal Health Systems at King of Prussia, Pennsylvania. They're the ones that are, at the end of the day, making everything possible. $20+ million that I think is going to really change a lot of things in healthcare, not only on the outside but also in the inside. Never forgetting from these beautiful faces here that I see looking over here, the number one thing, which is the quality of care for all of our residents in the Rio Grande Valley and South Texas. Thank you, Doug, for your leadership and all the CEOs. I can truly say that in the last, you've been here, what, Doug, 5 years? 10? Time flies when you have fun. But in the last 10 years, Doug has had a big job in getting a great team together. And of course, the results are here of what's going to happen, not only here at this campus, but probably some of the other campuses that we have throughout the valley. El Hospital Blanco is going to be gone, but the quality of care is always going to be our number one focus. And I thank each and every one of you for allowing us as board members to enjoy the what's coming ahead. I know it's going to be a quick 15 months, and God bless you, Todd. But thank the mayor, of course, and Commissioner Whitaker for being here with us this morning. Adelante, and I know that everybody's going to really, really be in awe when we do the ribbon cutting. God bless you. Have a good day, and God bless UHS.
Okay, we're going to go ahead and unveil the structure that we have behind us. It has the photos of the renovation project, so you can see a little bit more about what the facility will look like, not only from the outside, but from the inside. And we're also like to have our guests go over to the side of the hospital. We're going to have a commemorative paint the wall ceremony. So we'll have of course, our VIPs go out there and participate, and we want you guys to also help us paint the wall. So we've got 12 golden roller brushes and some helmets, and so we want to use this as an opportunity to do some photo sharing on social media. So if you have any social media apps, please use that and share it and spread the news. We'll roll the display over here to the side of the tent, and you can also take photos of that and share. So we'll be doing a lot of that over the course of the next couple of months. And let's have some fun painting. Thank you very much for joining us today.